Good afternoon and welcome to Grand Rounds in Psychiatry and Behavioral Sciences. Our MC, Jet Thompson, is out of the office today, so I have the honor of introducing the Grand Rounds and also introducing our speaker today. First, a little bit about our Grand Round series. So as you know, we do this most weeks during the year on Fridays, we are doing it using the webinar format. If you have questions during the presentation, please use the Q&A feature in the Zoom and write in your questions, and I'll do my best to get to those questions with our speaker at the end of the presentation. Our next presentation next week, just looking ahead a little bit, we're going to hear from Bill O'Connell and Anna Ratzliff about improving access to psychosocial interventions in Washington State, some of the really neat work they're doing in behavioral health workforce development. So if you have time to join us next Friday, please tune in. All right, with that, it's my privilege and honor to introduce our speaker today, Dr. Marquita Wills. Dr. Wills is an accomplished psychiatrist. She's an educator, an administrator, and a little less than a year ago, she assumed the new role of the CEO and medical director for the American Psychiatric Association. And importantly, Dr. Wills is the first African-American and the first woman to occupy this critical role in the society's 180-year history. So we're very excited about that.
Yes.
I'll tell you a little bit more about Dr. Wills. Dr. Wills is passionate about collaboration and innovation in order to deliver patient-centered, high-quality, equitable, efficient, and affordable care. Before she took this role at the American Psychiatric Association, she served as Senior Vice President and Chief Medical Officer for Johns Hopkins Health Plans. In that role, she helped optimize clinical and quality outcomes for health plan members, focusing on quality of care and also making sure that the care was efficient. And she oversaw pharmacy, utilization management, care management, and quality improvement, as well as other areas of Johns Hopkins Health Plan's Health Services Division. She helped set and enforce medical policies and standards for healthcare services offered to health plan members. So it's pretty clear that Dr. Wills knows a lot, not just about patient care at an individual level, but also at a population level. But today, Dr. Wills is going to share with us one of her areas, her own personal areas of passion and expertise, and that's the role of mindfulness-based therapies in psychiatry and how do we apply mindful strategies and techniques in our own lives to reduce potential for burnout. So with that, thank you and welcome to Dr. Wills. Great to have you here.
It's
great to have you in Seattle.
So wonderful to be here. And I just want to start by saying, of course, a big thank you to you for the invitation. This is my very first time in Seattle. I've never been to this part of the country before, so the weather held up beautifully for me, and it is such a privilege to be here. I have no disclosures. No financial conflicts, and want to just share with you some of the learning objectives today to learn the common applications of mindfulness-based therapies and the disorders they're used to treat, understand the practical applications of mindfulness-based therapies, thinking about it in relationship to disaster and trauma, and then also applying mindfulness strategies and techniques to your own life to reduce the potential for burnout. So let's start with a mindfulness moment. I know many of us have been running around all day today, caring for others, patient care, checking off lists, traffic, this, that, and the other, and we rarely have time for ourselves to just collect and center and ground. So let's just all do that for one moment. If you are not used to connecting to your breath in this way, I would offer and invite you to put one hand on your chest, the other hand on your belly. This will help you be more connected to your breath. Meditation is one of 8 limbs of yoga. And yoga really means union. So unifying your mind, your body, and your breath in this case is what we'll do for one moment. If you are comfortable, please close your eyes, feet planted firmly on the ground, back straight, upright, head over your shoulders, and then we will be quiet and silent for 1 minute and starting now. And gently wiggle your fingers and toes. And I invite you to come back into the room. Hopefully, that was a nice respite and break from the busyness of our day. So, I first got introduced to mindfulness and meditation at work. I was the psychiatrist on the team. I was working at a health plan in Tampa, Florida. And one of the leaders of the organization said, Wills, we hear that companies that have mindfulness programs baked into them have stronger engagement of their staff and employees, have more creativity, and have a better bottom line. And so go figure this out. Look into this for us and go figure it out. So I did all this research on meditation and mindfulness in the workplace and found that it was absolutely true. And they said, well, will you try to see if you can teach some of us about this? And I said, well, I better try this first before I, teach anybody about it. And I tried to do mindfulness for 10 minutes a day. I did it for 3 weeks. And after 3 weeks of doing it, I said to myself, oh my gosh, how could I have not been meditating before? I just opened up a whole new part of myself. And I got so excited about it and got deeply involved. That was before COVID. And then I went and met with a couple of gurus on meditation and learned how to meditate properly. And so that was a lot of fun. And then during COVID, my practice deepened. And it was at that time that I ultimately ended up doing yoga teacher training as well. So I am a certified yoga teacher. I became certified in February of 2024. I have taught a grand total of 12 yoga classes, all of which have been at APA with staff. So I teach yoga with staff, gentle yoga, and love meditation and yoga, and then also incorporated it into my patient care. So that's how I got into yoga and meditation, and want to share a little bit from a scientific perspective. So before I go to the slides, I do want to see, I think we have the chat open. How many people did that 1 minute feel like, oh my gosh, that was an hour? And then how many people was it like, oh my gosh, I wish I could do more of that? Because and so if people could just drop in the chat their experience with that 1 minute. And I know I have timed myself, so I know for myself that 15 breaths are about a minute, and that's how I'm able to know that we're doing just 1 minute. And it wasn't an hour for those of you who were like, oh my goodness, this is taking so long. So what does mindfulness mean to you? We have so mindfulness, somebody said they love it. Great, thank you. So mindfulness is really being very deeply present in the moment, fully connected to what's going on in a non-judgmental way. Many times when I ask people when they say mindfulness, they say calm. And I don't know that I think of calm as the right definition of mindfulness. Meditation can get you more calm, but you can be angry and be mindful that you are experiencing anger in that moment. So you want to just think of it as being in touch with whatever feelings you have at that moment, and being present. It's the opposite of autopilot. It's the opposite of driving home and things just happening and not really remembering your route home versus driving home and seeing the trees and recognizing how you feel about the day earlier and recognizing how you're feeling about going home. Maybe you've got a tough conversation with a kid at home coming up, but it's being present and tuned in a very non-judgmental way, to how you're feeling in the present moment. So mindfulness has its roots in Indian and Buddhist philosophy and tradition, but it really became prevalent in the West in about the 1960s. So during the time of the civil rights movement, during the time of lots of cultural transformation in the West. And in the 70s, Dr. John Kabat-Zinn introduced what he termed mindfulness-based stress reduction, or MBSR, to Western medicine. And that really marks the beginning of the mounting body of evidence that shows how there are actual health benefits to mindfulness-based strategies. And we'll talk a little bit about that. So I've got a few true or false questions here. And I'll give you a hint. The answer is the same for all three questions. Is mindfulness tied to a religious philosophy? Uh-oh, I'm going the wrong way. There we go. I'd say the answer to that was false. While mindfulness has its roots in Hinduism and Buddhism, it's not necessarily linked to any ideology, especially the way that we apply it in Western medicine. And that becomes important in some areas and geographies on how people will uptake and receive this modality and treatment. And so delinking and decoupling the health benefits from the ideology, I think, is an important thing for us to be mindful of, no pun intended. Mindfulness and meditation are the same thing. False. And we'll get into that on the next slide. Mindfulness is not just another name for meditation. And I'll talk about the differences on the next slide. They're very closely related concepts. Meditation helps you become more mindful, but we'll talk about that on the next slide. And then false two, mindfulness fixes all things that ail human beings. No, well, mindfulness is not about fixing something that's wrong, but it's about feeling and fostering that better understanding of oneself, and deepening that mind-body connection. And we did it through mind, body, and breath. So I promised that I would talk about what the difference between meditation and mindfulness is. So mindfulness, again, is that concept of being present and aware in the moment, tuned in, tapped in, turned on, not just going through the motions, but being aware that you are sitting in this room, being aware that it's a beautiful day outside, and not just being here, just thinking mindlessly about what's going on. Meditation is actually a formal practice that strengthens one's ability to be mindful throughout the day. So meditation is really pulling away from the world, like what we just did. We did a meditation moment. I call those meditation snacks, where you just do it for one moment. And that is something that's really important because you can do that at any time. When you're feeling overwhelmed, when you're like, I don't even know where to start. Oftentimes, just taking that 1 minute, counting out your 15 breaths, going inward can really help clarify then what's next and how to prioritize and what's most important. And so meditation is that formal pulling away, sitting down. Transcendental meditation, which was popularized in the 1960s, they do 20 minutes of meditation. We just did 1 minute, 20 minutes of meditation twice a day, once in the morning, once in the evening. And common types of meditation are what we did, We focused on our breathing, that in and out, in and out. So being conscious and aware of every inhale and every exhale. And again, connecting your hands to your body can help with that sensation. There's also auditory or visual cues. So people can look at a flame, have a candle lit and look at a flame. That's a very common form of meditation, to just set a timer and look at a flame for, let's say, 5 minutes or 10 minutes. Another is repeating certain mantras. Om is a popular one, which is really a word meaning creation. And so Om is another one that people use, just chanting Om over and over and over again. Generally, you do want to close your eyes when you're meditating, but for people for whom that's a trigger, just softening your gaze and looking down is another very easy way to really close out the stimuli from the world, and focus inward. And it really is, again, about connecting inside. Health benefits. So, are there really health benefits? So, there's longstanding beliefs that mindfulness supports both mental health and general well-being. And guess what? There is a growing body of evidence that is saying, yep, that general belief is actually true. We're finding that that's true. And I'm going to talk about one of the studies that one of my residency classmates did on that. So, stress and anxiety reduction are the most commonly cited benefits of mindfulness interventions, which make it helpful in treating anxiety, depression, and then, of course, for ourselves as practitioners, helpful in treating burnout. And mindfulness is also very much associated with other healthy lifestyle patterns. So, folks who are mindful and meditate regularly and frequently can then become mindful about what they eat, mindful about how much water they're taking in every day, mindful about a lot of other health promoting behaviors. So it can oftentimes be a positive gateway into an overall enhanced lifestyle, mindful about what causes them stress, and being more mindful about avoiding stress and that sort of thing. So there are a lot of health benefits to mindfulness. There have also been some studies that indicate that mindfulness is helpful in blood pressure control. So mindfulness is really a very helpful modality in helping stress and other health behaviors. I stated earlier that Dr. John Kabat-Zinn created a formal program called MBSR, or Mindfulness-Based Stress Reduction. And I want to just spend one moment on what that is. It combines elements of Hatha Yoga. That's the yoga tradition that I'm actually trained in, Hatha Yoga, which is like a slow flow, gentle yoga. Hatha Yoga, mindfulness meditation, and also body awareness. And it brings all of that in so that people can begin to be more conscious of what their stress triggers are and also where it shows up in their bodies. This is something that we don't often talk about, but when we are stressed, some people feel tenseness in their legs. Some people feel queasiness in their stomach. Some people feel hunched up shoulders, but it allows you to become more aware of the physical manifestations of the feelings that you're having, so that you can then do something about it. So it's a standardized, pretty straightforward, rigorous 8-week program, and it handles the things that are listed there. So helping coping skills, helping identify stress triggers, creating that non-judgmental awareness of the present moment, that mindfulness, that definition that we go back to, where we are aware of what's going on in the present moment so that we can modulate it. And in doing so, really it's helping to build self-compassion, because we all know that every one of us has a negative chatter that goes on in our brain. And focusing and practicing on being non-judgmental and releasing that negative chatter allows us to build more capacity for forgiving ourselves, for being less guilty, for congratulating ourselves, and for having more self compassion. And that allows us, when we have that ability to pause, to be clear about where we are at any given moment, it allows us in any situation to respond rather than react, to address stressors with more of a wise mind, as they say in DBT therapy, with more clarity. And that ultimately builds capacity for resilience and not just bouncing back, but bouncing forward into the learnings that come from that clarity in responding. And ultimately leading to overall well-being and enhanced quality of life. So there are a lot of studies around MBSR and its use. So what do we see in practice? Where are we seeing this in practice the most? We've got MBCT, which is a fusion of MBSR and good old garden variety CBT, and that's used to treat generalized anxiety disorder, overall emotional distress, and there's evidence that it's very helpful in addiction work as well. Many of us, of course, know DBT. That was developed by a psychologist, Marsha Linehan, in the 1970s, and that uses CBT again, mindfulness, but it's really targeted towards emotional regulation. So using grounding techniques and other centering techniques to help people understand the dialectic nature of emotions, that you can be both angry at someone and love them, that you can be both ready to go for a new job interview and have fear, and that you can hold both of those poles at the same time. It was specifically designed for people with borderline personality disorder who cut or had chronic suicidal ideation or other self-harming behaviors, and it allows them to manage with coping skills the big emotions that they often have when they have borderline personality disorder. And then one other common treatment that was developed by Jack Apshe is mode deactivation therapy for adolescents, where it was developed for conduct disorders, emotional disorders, and it's also used in group couples and family therapy. Um, Other things that are related to mindfulness are heart math, so biofeedback, and making sure that as you're doing your deep breathing, you're hooked up to machines and recognize that your blood pressure goes down, your pulse goes down. So there are truly physiologic benefits to focusing on mindfulness. This is the study that I had foreshadowed earlier. The first author on this is my residency classmate, Dr. Elizabeth Hoagie, who's now at George Washington in Washington, D.C. And it studied MBSR versus SSRIs. And I've had the privilege of talking to her about it. And she says, it's the study of one letter, meditation versus medication. So that T versus the C. So it was a randomized clinical trial which compared MBSR to escitalopram, an SSRI that we know we use all the time for anxiety. And it showed that there was comparable effectiveness to first-line medication for patients who had anxiety disorders. So it was just as good. And I remember when this came out in 2023 because I saw her on CBS the Evening News and I was like, there's Liz, there's Liz. I was so excited for her and so excited that she had deepened her research in this area. So MBSR encourages patients to treat their thoughts and sensations as just transient. They come and go, they're part of life, and they don't necessarily have to represent reality. It was delivered in person with trained teachers who showed them how to do that. So I was really proud of my residency classmate with this study. showing that it truly is an important modality. And I see a question in the chat. Will these slides be available after the webinar? We certainly can do that. We can make them available. Happy to. I had the pleasure of visiting last weekend in Oklahoma. It was the 30th anniversary of the Oklahoma bombing, and I was able to deliver a CME with a world-renowned trauma disaster recovery psychiatrist. Dr. Sandra Koifman went with me, and so I pulled some of those slides in here as well, as how mindfulness is specifically been studied for trauma, So as we all know, the neurobiologic effects of trauma, it impacts that old brain, that rudimentary brain, amygdala, hippocampus, but also some of the newer brain as well, the prefrontal cortex. And it relates to cortisol release. And there are mental health effects of that neurobiology perturbation. So you can have PTSD, you can have anxiety, depression, and grief. You can have poor concentration, intrusive thoughts, increased substance, sleep disturbance. We all know that trauma can manifest itself through mental health symptomatology. But mindfulness has a role in helping to buttress that capacity for recovery. Resilience is the ability to adapt, recover, and in fact, again, not just bounce back, but not bounce forward, thrive in the face of adversity. And mindfulness is a tool that can help with that. It helps with emotional regulation. We talked about that before with DBT. It helps with adaptive coping, and also bringing down that stress and those big feelings that can happen after trauma. So it does so by lowering the cortisol levels and also strengthening prefrontal cortex activity, which improves how we respond to distressing emotions when they arise. And it helps survivors stay present so that they can process trauma without being hijacked by all the big feelings that they may have. So that's sort of the mechanism there. There are different ways that this helps. Deep diaphragmatic breathing, which activates our relaxation oriented parasympathetic nervous system, going back to some medical school terms, and that can reduce and dampen that hyperarousal that we see in acute stress disorder or PTSD. Also, body scan meditations really help a person drop into their body, reconnect with their body safely after they've been through a significant trauma, whether that be a personal trauma, a fire, or things like that. And then grounding exercises help as well. I put the 5, 4, 3, 2, 1 on the next page. We can go into that deeper, but that just grounds us. It pushes us into our senses, to use our senses to connect deeply with the present moment. And that can be helpful for trauma survivors. And then self-compassion. We all already talked about that self-criticism that we have, that shame that can sometimes happen after trauma, that guilt that can happen if you're a trauma survivor. And so having the tools and the capability to be more forgiving of yourself and to not beat yourself up is an important aspect. So when you practice on the cushion, when you practice on the mat, letting judgments go, that non-judgmental, it then translates into your life outside. Why are they effective? I think we went over most of this already, but the one thing that I did want to say is that our brains are often always changing. So that neuroplasticity is important, that our brains are evolving. And this is like doing exercise for the brain, exercise for our emotional system, exercise for our central nervous system. So just like we go to the gym and lift weights, This is practicing to help our brain evolve and change. And that's an important thing. I think that's the new thing on this slide. So I won't make us go into another mindfulness moment, but I will talk about the five senses just so that you have this. And this is good for when you're standing in line and you see yourself get anxious at the bank and you're like, I don't want to be waiting here. I got so much to do. Well, one of the things that you can do is this five senses grounding techniques. So you think about five things you can see at the moment, four things you can feel. Right now, I feel the inside of my shoe. I feel the seat where I'm connected to the seat. I feel my hands on the table, and I feel my glasses on my nose. So four things you can feel, three things you can hear, whether it's a refrigerator humming, someone chewing, your own breath. Two things you can smell. Sometimes that gets a little tricky and hard. Just ferret that out. And then one thing you can taste. I'm sorry, there's a typo there. It's one thing you can taste. So it's supposed to be your five senses, and it's calming. It turns your attention away from thoughts or memories or worries. And that's why it's good for folks with trauma. It helps you regain control right there in the moment by focusing on the present moment and experiencing what's going on and being present. It's best used if somebody is highly anxious, trauma sufferers. I could have used this right before this grand rounds to get myself together so that I wouldn't be nervous, and then work-related stress or performance reviews. So we can use this ourselves. Now, shifting gears a little bit from the trauma piece to the doctor-patient relationship. So one of the things that one of the purported mechanisms of mindfulness is that it allows us as humans to become more self-aware. And that self-awareness and that insight is a critical component. So it's really deepening self-awareness. Um, and I think that's one of the most important mutative changes, that positive mutative changes that leads to that neuroplasticity, is that you're more connected to yourself. And so in the doctor-patient relationship, it encourages attentive listening for both. It increases empathy, ability to be connected to one another. And I think that's why it works in teams. And it focuses on positivity, which can reduce treatment anxiety for patients as well. So it opens up that valence of communication between the doctor and the patient. And most recently, I was seeing patients in the student health setting. And so every single patient that I had, I would teach how to meditate. Every single patient. And you generally took like 5 minutes, and I'd sit there and do what we did earlier, which is the 1 minute of meditation. And I would write it on a prescription that I would like for them to do three weeks worth of 10 minutes a day in the morning of meditation. And I would write that as a prescription in addition to any medications that I would prescribe. And about 50% of them did it and 50% of them didn't. So some people did it and some people didn't, and that was okay. I wasn't trying to force or, put a gun to anybody's head to meditate, but just offering it as an adjunct to the therapy that they were already receiving, because students had to be in therapy in order to get referred to the psychiatrist on this particular college campus setting, and would add that in. And I'd say of the 50% that it stuck, probably another half kind of got into it and realized that after 3 weeks, oh, this is helping me. And it was a gateway to building that doctor-patient relationship. And as we alluded to earlier, mindfulness is not just for patients, it's for us too. It's for us as caregivers to have address burnout. Now, it's not the only thing. There needs to be systemic changes as well. So it's not like the only thing, but it can absolutely make us more empathic, better caregivers. Again, that self-reflection and self-awareness is critical, and that ability to be fully present and respond rather than react really helps aid us in our clinical decision making as well. So hopefully this is a fun thing that everyone can incorporate into their lives. And again, it just takes a minute. I would say that most times people who meditate even just 5 minutes a day, certainly 10 minutes a day, but even just 5 minutes a day, every day is a good thing and can help bring benefit and change. And the change doesn't come immediately. It's not like you meditate for one moment and the skies open up and everything is fixed. It's not that. It's not that. It's something that takes 2 to 3 weeks to like really take, where you're like, oh yeah, now I get why people do this. The more does appear to be dose dependent, so to speak. The more you do it, and the more frequently you do it, the more benefit you get from it. But it's definitely something that I would encourage folks to at least experiment with. And at 3 weeks is when I think, is when people most feel the benefit. So, in conclusion, growing body of evidence that supports mindfulness-based interventions. And this is just one tool in our toolbox, along with therapy, along with neuromodulators that are coming out, along with psychopharmacology. This is just one additional thing that can help with adherence, help with building that doctor-patient relationship, and combining this with core parts of our training can yield the best results. So I am 100% open to questions, and would love to interact with all of you in the various clinical sites. Thank you very much for this opportunity to come to Seattle and share something that I'm passionate about with an awesome department. So thank you.
Well, thank you, Dr. Wills, for a wonderful introduction to the role of mindfulness and meditation. As I said, for our listeners online, if you have questions, if you want to type them in, I see we're getting some. We'll do our best to get to that. And then we have a couple people here in the room, and I'll invite you to ask questions too. It's a very long one.
It's a good one. Somebody who's an avid meditator like myself, but I haven't been doing it for a decade, almost a decade. But I definitely meditate 20 minutes a day for sure every morning. Personally found great benefit from mindfulness and meditation. However, seen deep meditation, particularly during longer practice, destabilizing. Yes. It's not uncommon in the meditation community to have difficult experiences, especially when situations arrive that create this illusion of the ego. Yes. Well tolerated by the general population. There's a growing amount of case reports that meditation retreats and longer practices can trigger first-time manic episodes or psychosis. With all that in mind, are there contraindications to mindfulness and meditation? And is there a certain dose of medication that's too high for some folks? And did you mean meditation, some dose of meditation that's too high for folks? I think maybe so. It's that C versus T again. So I would say there are a subset of patients that meditation does not work for them, period. It is destabilizing. It is anxiety provoking. Sitting there thinking about their breath can throw them all the way off. And so for those patients, like to think of it as, well, what else can get you, quote unquote, I'm going to borrow this from sports psychology, in the zone. And there are other things that can get you in the zone other than meditation, in that space of flow. And PET studies have shown that people who are in flow and people who are meditating have very similar brain patterns. So if meditation is not for you, then they've got the coloring books out now where you're coloring the beautiful things with colored pencils. Some people say that running puts them in flow, that repetitive long distance running is a similar mindset as meditation. Other people say yoga If somebody needs to move, right? It's not about sitting there quiet for a while, but you need to move, but you want to get into some sort of flows. Yoga is another way. And then artists often find painting is another thing that gets them in flow. So, yes, there are people for whom yoga and meditation, I'm not going to say necessarily contraindicated, because I have used meditation for first break psychosis. But it's short. To your point about, is there a dose? I wouldn't want them to be sitting there doing 20 minutes of it twice a day, but maybe 5 minutes of it to, again, develop that insight and awareness and self-insight. So I do think that it's very important to recognize that there are some people for whom meditation is not going to work because it just stresses them out even more to be sitting there, and they need to be moving. Hopefully that gets at some of what you're asking there.
Okay.
Uh,
Other thoughts, other questions from anybody on the audience? Okay, got another one?
Okay, your mindfulness minute helped a lot, and you conferred to me to keep trying this. What about with people with neurodiversity? What do you think of benefits of mindfulness for neurodiverse individuals? Any thoughts on how we can suggest meditation, mindfulness, and support system and flows for neurodiverse individuals? Thank you again. Absolutely, absolutely. I think that this, I really do believe that self-awareness is such an important part of what mindfulness and meditation does. And that can be particularly helpful for neurodiverse individuals who are learning how to better connect in with others. I actually happen to have a godson who is neurodiverse. He has Asperger's. And I have taught him how to meditate. And it has helped him with regards to his interactions. He's on a college campus with Beacon College in Florida, with neurodiverse individuals and individuals who have different learning styles and disorders. And it has helped him push out in terms of connecting with other people, and being more clear about his own feelings and himself. So I do believe that for neurodiverse individuals, it is certainly something that can be done. And then I love to push in your question, anonymous attendee, for the support systems, because support systems need support as well. And this is something that people can support each other in doing, is taking that time away to center, to ground, and to be more ready for the vicissitudes of life that come at all of us. We all know that. We all get knocked down, and this is a way to buffer and build that resilience capacity for us all. I think there was one more. Oh, yep, websites, apps, books to start with MBSR, particularly no cost. Thank you, Whitney, for that question. Okay, I need to add this in a slide in, because I get this question a lot when I'm doing grand rounds, and I don't have this off the top of my head, but what I can tell you is not no cost, but I am a big Calm app user. I really like the Calm app. I use that one a lot. But people say hands down the best is Headspace. I have heard that from other psychiatrists who are practitioners. That one apparently has a lot of different modalities, a lot of different use cases, and Headspace is supposed to be heads down the best. There are also some, and I need to have this. I don't have this information, but you know what? We will get this information for you, Whitney, and send it back. Because I get this question a lot, and all I know is the apps. And the apps do work. The apps do work. And I understood with regards to the low income population. And I have this reference, but I don't have it with me because we talked about this. Somebody shared this at my last grand round. So thank you, Whitney. I apologize for not having that on the tip, but we'll get back to you on that.
The comment about the caregivers, I think that's also a really important one. I've done a lot of work with dementia caregivers, and when you're at a place where you're ready to go off on somebody because you're just totally overwhelmed, you can use these kind of techniques even very, very short, very, very effectively.
That's right. Those snacks, they work. They really do. That 1 minute of like, oh my gosh, I got 1,000 things to do, or oh my gosh, I'm getting ready to go off on somebody. Just pulling away, going inside really helps. I see.
How about others in the room?
What's in the
Anybody have any-
chat?
Yeah, if you can move the mouse, just select that.
Oh, right, have to move our mouse here.
Oh, there it
Yeah,
is. Okay.
scratch that. There you go.
Slides available, yes. PA and psychiatry. Be my mentor. Collected some resources to share here. Oh, great. Thank you, Aaron. Thank you, Aaron. That's so great. Dr. Green Mindfulness. Appreciate that. Thank you, Aaron. I'm gonna see if can somebody email me that?
Aaron Green, one of our faculty at Harborview at our county hospital.
Oh, wonderful,
Does a
wonderful.
Beautiful job when he collects these kinds of things to make them available to everybody else.
I love that.
Yeah. So thanks, Aaron. All right. Other thoughts, reactions, people in the room here? Anybody have any questions for Dr. Will?
Does anybody, is it too woo-woo for anybody? Are there some people who are like, oh my gosh, I'm not doing that. That's just woo-woo. And that's real. I mean, that's how I was when I first was exposed to it. I was like, what are these people doing? But I got more into it, and now I've even got my 83-year-old dad meditating.
Thank you so much. I work at the state hospital with teens, kids that do lots of unsafe things. And this is magic. This is one of our magic ingredients, is teaching teens to stop for 1 minute, be mindful before reacting. And it takes them a long time to practice that, but it's a game changer because suddenly all sorts of things get recruited and they can use other skills and think about what skill to use.
Yes.
But just the
Yes.
meditation bit is, if done well, does seem to be one of the magic ingredients that I've seen.
Yes, and I've seen some studies in Baltimore, if in kids in tough neighborhoods in Baltimore. And when you teach them how to meditate, detentions go down, absenteeism goes down, fighting in school goes down. And so getting kids involved in meditation and mindfulness is just a beautiful tool for them to have in their armamentarium of coping skills as they continue into adulthood. So thank you for sharing that. Headspace is available as a benefit for faculty based at Seattle Children's. Nice. Oh, hey, Ray. Thanks, Ray.
The other thing I wanted to point out to you as you were referencing it, Marcia Linehan was one of our faculty. She did all of her work here in the Department of Psychology. She had an adjunct appointment in our psychiatry department.
You're kidding. I did not know that. Oh my
You
gosh.
should know that since you're here at the university.
Yes, I need to know that. I need to know that.
A lot of us were trained in DBT because of that. too.
Because of her.
Yeah.
Oh, wow.
Yeah.
Wow, that's amazing. That's amazing. I did not know that. I thought she was in Boston, so I'm glad y'all set that record straight.
She talked about this. She developed this based on her own experience.
Oh,
This is very much I need to learn how to center myself, how to ground myself before I explode on myself or on someone else. And she talked about that.
Mhm.
Yeah, I like also that she has other mindfulness strategies like describe and participate, which I think are much more active forms of meditation, like mindfulness, because I think for the people who can't sit still to start.
Yes.
It's kind of a nice option.
Can you say more about that, Anna?
Well, she described as one of the mindfulness techniques that they talk about, and it's more like instead of like grounding yourself, you just start describing the things instead of like sinking into connecting to those thoughts. Like, you know, if your mind's sort of running off on a anxiety tangent and instead you're just like, oh, I see a picture, I see, you know, the wood, I feel it's kind of similar to the 5, 4, 3, 2, 1.
Okay.
It also could be like, oh, I'm noticing those thoughts again. There they are again.
Yes.
Isn't that interesting?
Yes.
And
Wow, it
taking
came up
some of
again.
taking some of the judgment out.
Yeah, it's just
Just describe it, what you see.
Just describe it. Just describe
Don't
it.
need to have all the thoughts about this is good, this is bad, this is gonna harm me.
Mm,
Just
Yeah.
look at it and say, I see a picture with a mountain, then it must be a sunset. And you know, that just get you off of all of
Mhm.
the chatter that's
Yes.
running in parallel.
Yes.
And participates like whatever you're doing, being able to just be present in it. If you're washing a dish, are you feeling the water? Are you holding the dish? Do you, feel your feet on the ground? So it's similar grounding kinds of
Mhm.
things, but you can do it when you're doing something, which I think for some people can be just easier to start there.
And I think that's also an important thing too for like moms.
Yeah.
Who people are busy and don't have time and can't pull away. Well, you can be present, like you said, washing the dishes. You can be present braiding your child's hair, right? And so you can turn almost anything into a meditative experience.
meditative
Yes. Mhm.
Yeah, I was actually curious though, you started out saying that this started in the context of being in a system and thinking about this at a system level. And I always feel like there can be this tension between offering programs like this as a system and saying, this could be really helpful to you as an individual, and people saying you're using that as an excuse not to address systems problems that are actually causing some of the stress
Yes.
and distress. So I'm curious, in your experience, how can you have this be sort of complementary maybe, or, how do you talk about it in that way so that people still, can get the benefit of this? Because I think even if you're in a system that is very stressful, it can be useful to have an individual practice while also still acknowledging that some of the context for stress is often systems based.
Yes. Well, when I think about it in terms of the work context and doing the sort of initial work that brought me into this, one of the things that they talked about was developing a common lexicon for how people often open up and greet each other in meetings. So one of the things that they talk about is a mood elevator that everybody learns and everybody knows, so that you can just sort of say, well, coming into this meeting, where am I? I'm curious, I'm dejected, I'm this, but everybody's got a same lexicon. Starting every meeting off with, a moment just to be quiet, where people just say, okay, think about who you want to be in this meeting. Think about what you're bringing. What are you trying to get out of it? So just setting it up like that so that everybody comes into the meeting, making sure that you finish with 5. So none of this back to back. Everybody's running late all the time, 1 or 2 minutes late to the next Zoom or the next whatever, but finishing each meeting with a 5, with a grace period, and knowing that that's part of it. So trying to put into each meeting, each modality, a way to recognize that we're human and we need to come into each meeting, each session, checking in with one another, checking in with ourselves, and that can help us be more creative as a group, and produce more creative results. So that was one way that, from a systemic perspective, embedding it into how we all relate to each other. The pause. Who am I leaving? How am I feeling? And who am I going to see next? That's right. So that we don't take one emotion into the next interaction. That is very important to we center ourselves as we move from patient to patient to patient, and embedding that into the workflows. So even those small adjustments can, from a systemic perspective, if you think through all the different workflows and touch points that we all have, there's got to be a way to do them more mindfully, and that we agree to do them more mindfully, and that sort of thing. So that would be how I might at least start to answer that question on on how we, because it is too much to do, too many responsibilities, this, that, and the other. That there's the reality, but how can we do that in a way that puts our humanity at the center as we're doing that? Did you have a
And
question?
we shouldn't try to say, if there's a big problem that needs to be fixed, just be mindful.
Right.
I mean, we can say, we might be able to be better if we try to work together to fix it, if we can do that mindfulness part at the front of it. It
Yes.
doesn't mean that there isn't a problem that
That's
we don't
right.
need to fix it, right?
That's right.
Yeah,
That's
go
right.
ahead, sorry.
The studies that showed that providers who were using mindfulness techniques were giving better care. How did they measure that?
I don't know. That's a good question. I'm not sure about that. Let me go back to that and see, because I did put a lot of. So, oh, here,
Yeah,
right
okay,
there.
you go.
We have a lot of references.
Mhm.
Oh, let's see.
It was like 11 and 13 or something.
The impact of mindfulness. Which one is it?
I thought it was 11 and 13, but I could be wrong.
Well, we've changed this so much, it might not be there. Neuroscience of mindfulness meditation. I don't know. I honestly don't know the answer to that. So we'll follow up on that question too. So we've got apps and free resources, and then we've got was that study designed? Is that what a pilot study and randomized control trial of the mindful self-compassion program? No, that might not be it either. But I did realize I have other things that I wanted to talk about before we wrap in the last 1 minute.
Okay.
Why is it important to be involved in organized medicine? We at APA are our voice on the national stage right there in Washington, DC. And we need everyone's voice to be a part of that, to make sure that we are tackling the key issues. We were talking earlier today about reimbursement, workforce demands, social determinants of health, physician wellness, scope of practice. We were talking about that, administrative burden, so many things. And we at APA are working on all of those to transform what tomorrow looks like, and need your voice, your passion with that too. Questions that I get a lot are around advocacies, especially in 2025 right now in the current climate. These are the principles that we're living by, staying focused on psychiatry, working on both sides of the aisle, protecting vulnerable communities, including institutions and patients. That is a core part of our identity, regardless of what acronyms you use or don't use. Attacking positions with science and evidence-based medicine versus attacking people. Respecting that we have membership and staff across all parts of the political spectrum. So really valuing and acknowledging all perspectives. And one of the things that I say about that is, I didn't know this until I was interviewing for this job, but the American Psychiatric Association is the oldest medical professional society. In 1844, it was established. And, I believe that, so we're older than AMA, we're older than Derm, we're older than OB-GYN, we're older than everybody. And I believe that as leaders, it's important for us to role model for the world what it looks like to have tough conversations. And we're experts in affective regulation, we're experts in empathy and deep listening. So we have to demonstrate that within our organization. And I think we've gotten to such a divisive part in our nation's, at this moment in our nation's history. And I'm excited about having us as psychiatrists lead the way there. We also partner across the House of Medicine. So we are in coalition with other primary care organizations and then other mental health. Psychiatry residents are an important part of who we are. We're going to be spending a lot of time over the next couple of years, really ensuring that we're tailoring our offering to meet the needs of our younger physicians, our resident fellow members, as well as our early career psychiatrists. And then I invite you all to LA, right down the road, for our annual meeting coming up in May. I'll be back out on the West Coast for that. We've got Venus Williams as our keynote speaker for our opening session. We have the former president of Liberia for our diversity session. So we've got a lot of exciting things. The theme is lifestyle psychiatry for positive mental health and physical health under our president, Dr. Ramaswamy Viswanathan. So please consider coming down the road. And I am definitely excited about taking psychiatry to the next level with all of the psychiatrists, 39,000 psychiatrist members that I have the privilege of serving every day. So thank you very much again for the invitation to come. It means so much to be here, so.
Thank you
yeah.
for a wonderful presentation. And with that, I think we will wrap today's grand rounds.
All
Thank you
right.
all. We will see you again next week if you can join us.